Hey, good morning, everybody. Hope you all had a great night. It is Wednesday, March 18th, 2020. I don't know if any of you went out celebrating St. Patty's Day yesterday, but if you did, hopefully you're home and recuperated. I wonder if McDonald's is still having their Shamrock Shakes today. Wasn't that like the best thing about St. Patrick's Day growing up is the Shamrock Shakes? So I don't know if they are. Run out and get them. That's the best thing. Anyway, it's Wednesday, so we're past St. Patty's Day. As always, I want you to think about our quote of the day. Forgive me if you can't see it very well, but it says the first step to success is to not give yourself any other options. The first step to success is not to give yourself any other options, which I think is great, is once you realize in your mind that you are going to succeed, just don't, there's no other option. You're going to succeed, that's just the way it is, and so you just do it. So think about that, how that applies to you in your life. We are going to start off with, if you can, just take out some paper and pencil. You might want to write down some notes. Last time, not yesterday, but the day before yesterday on Monday, we were talking about, I was giving it lots of definitions of words, and we talked about malpractice. So we're going to go into the different aspects of malpractice. And just to kind of refresh your memory, malpractice is the professional negligence or failure to provide due care. Professional negligence, okay? And it says all four of the following must be present in order for a malpractice case to be successful. So I'll put malpractice. Okay, and all of these must be present. One of them is duty. And duty is a dentist-patient must exist to establish the duty. A dentist-patient relationship. A dentist-patient relationship. Must be present. Because if there is no dentist-patient relationship, then, how can it be malpractice? I have no relationship with this person. Just because I talked to my friend about a dental problem, he can't sue me for malpractice. We never had that relationship, okay? So that one is duty, two is derelict. And that is negligence occurred because the standard of care was not met. Oops. Okay. 3 is going to be direct cause. And that's going to be the negligent act was the direct cause of the injury. And I'll step away in a minute so you guys can write this down. And 4 is damages. Pain and suffering. Loss of income. Medical bills. Okay, so all of those must be present in order for us to call that malpractice. Let me see if I can step aside and have you guys read that. Okay. Okay, let me ask you this. If the dentist injects the wrong side of the mouth, say I'm wanting to do number 19, but I accidentally inject on the side of number 30, is that malpractice? You think yes, no? Well, it would not be considered, does it? The problem with it is that there's no harm done, right? There was no grounds for malpractice. There were no damages occurred. Yeah, the patient was numb on that side for a little while, a couple hours. But there was no pain and suffering. There was no loss of income. I mean, listen, the patient could say, oh, it was so painful, I was numb for 2 hours. But really, there was none of this. And in order to be malpractice, it needs to follow all of those things. So that would not be malpractice. Yeah, it's a bummer. Yeah, the dentist may lose that patient, but it's not going to be considered malpractice. Okay? Let's move on. Let me erase this. And FYI, you guys, if you're not getting all this written down, I will also make sure that I send you all my notes. Everything that I'm writing down, I'll make sure that you can get a copy of. Okay? A couple of new words for you, or new definitions, kind of odd ones. They use a lot of Latin terms in law, and this is kind of an odd one. It is called doctrine of res ispa loquitur. Loquitur, okay? I know that's an odd one, okay? What that means is the act speaks for itself. The act speaks for itself. And in a case like this, you wouldn't need an expert witness to say, yes, the doctor did something wrong. The act speaks for itself. And an example of that would be, doctor took out the wrong tooth. Took out the wrong tooth. Doctor took out the wrong tooth. Here's the thing. The act speaks for itself. There's no denying that. There's no making an excuse for it. There's no changing it. The act speaks for it. He took out the wrong tooth. That's basically it. You know, the doc knows he's going to have to pay for it. There's really no reason to go to court for that. Why would you? There's nothing you can do to defend against that. So the doctor ends up paying, some kind of settlement, and you're done. Okay? Another term that we want to know is informed consent. And that is the dentist must give the patient enough information about his condition and possible treatment options. Informed consent. The dentist must give the patient enough info about his condition and possible treatment options. That means I say to the patient, Mr. Smith, you need tooth number 3 extracted. And that's all I say. Need number 3 extracted. But I didn't tell him why it needs to be extracted, what his options are, what could possibly happen. I could possibly, when I'm giving injection, might leave that whole area, you might have paresthesia permanently or temporarily. You need to let the patient, and which one of you guys are telling me that I didn't spell this right? Dentist. I just figured that out on my own. Must give the patient enough info about his condition and possible treatment options. So, and again, informed consent, I could tell you it, but you also better have it in writing. So in my office, I have a little cabinet up front that had all these little slots in it. And depending on what procedure we were doing, we would have our own informed consent for each procedure. Say we're doing an extraction. On the extraction informed consent, it lists all the information about an extraction. It lists everything that could possibly happen. It always need to have the risks, the benefits, the choices. Every time I write in a patient's chart, I always put RBAs, risks, benefits, and alternatives were given. That means that I explained all the patient, I explained to him what was going to happen, what could happen if he had the extraction, what could happen if he left it alone and did nothing, and give him alternatives. What are the choices that you have? Make sure, and I would always put at the end of my notes, I'd say RBAs were given, RBAs, risk, benefits, and alternatives were given to the patient. So they know that they had the option, okay? So that's informed consent. I'm informing the patient about what we're doing, okay? As opposed to, remember yesterday when we talked about implied consent? Implied consent that is given when patient walks in the dental office. Remember I said it is implied, this patient walked into my office, came in, sat down, sat in my operatory chair. It is implied that he or she is seeking treatment. He may not have said, hey, I'd like to have you fix my tooth, hey, this. It is implied, if you're in my office and I get you back in my operatory, that you are giving me consent to treat you. Make sense? Okay? That wraps up, if I'm not mistaken, let me just make sure I've got everything, all the definitions that we needed to know. Between that and the lessons we went over, that is about it. Like I said, I'll take a picture and send this out to you guys. But there is some kind of tricky definitions that you need to know. Like this one may be just common sense to you, but this one up here may not. So know that those ones that are in Latin more than likely are going to show up on the test. Okay? So that's it for the moment. I will get back to you guys soon. Thank you.